Did you know your diet after 60 could decide whether you age with strength or struggle with disease? Too many seniors fall into dangerous diet myths, but today we'll reveal the foods that keep your body strong, your bones unbreakable, and your mind sharp as you grow older. As seniors age, they experience different levels of physical function loss, which raises their risk of contracting many illnesses. Managing food intake is just as important as getting the medical help they need. Healthy nutrition is the cornerstone of senior health. It helps maintain bodily function, prevents common age-related illnesses, and even slows aging and improves quality of life. What are some common health issues among seniors? The doctor explained that as they age, they often develop problems with high blood pressure, diabetes, heart disease, stroke, lung and kidney disease, joint pain, osteoporosis, and visual and auditory impairments, which can lead to a range of complications. But before we dive in, if you are concerned about your health, you can subscribe and activate notifications to stay informed about relevant health topics. Please put 1 in the comments if applicable. Otherwise, type 0. We are committed to enhancing our content to provide genuine assistance. Well, let's dive in. Inadequate stomach acid, delayed gastric emptying time, slower intestinal motility, tooth loss, and decreased secretion of digestive fluids are some of the physiological and metabolic factors that lead to worse chewing and incomplete digestion in older people. Bloating, gas, and indigestion are some of the symptoms that could appear. Basal metabolic rate is about 15% to 20% lower than middle-aged people, reflecting the gradual decline of metabolic function. Catabolism, rather than anabolism, increases with age. This is particularly true for proteins, where catabolism is more prevalent. Diabetes is more common in the elderly because of changes in glucose and lipid metabolism, insulin secretion, and insulin sensitivity. It makes them more likely to develop kidney disease, blindness from diabetic retinopathy, and numbness and pain in their extremities from diabetic peripheral neuropathy. These changes in body composition cause bone mineral density and bone matrix to decrease. Osteoporosis can develop when calcium levels drop, as lower bone density is associated with lower calcium levels. After menopause, estrogen secretion drops, making osteoporosis worse. Bone density drops by 10% to 15% in the first decade after menopause. As a result, older people are prone to varying degrees of osteoporosis and fractures. Once a fracture occurs, it increases mortality. Long-term bed rest after a fracture can cause pressure sores, skin ulcers, and lung and systemic infections. Older people also experience a gradual decline in organ function, such as decreased liver and kidney function. The liver and kidneys of a 70-year-old are only half to 2/3 as good as they were when they were 30. Less pancreatic fluids make it harder for older people to control their glucose metabolism. Around 40% of people aged 65 to 75 have trouble regulating their glucose levels. They are also more likely to get colds, illnesses, and cancer because their immune systems are less effective. Many older adults have developed dietary habits over the years. For example, Northerners prefer refined rice and flour, and some older adults even enjoy lard. In fact, according to nutritionists, this is unscientific. The doctor believes that older people must overcome common dietary misconceptions. Consuming porridge regularly is believed to nourish the stomach. Most older adults suffer from dental problems and poor chewing function, leading them to consume porridge regularly. A few, however, prefer to consume porridge regularly to nourish the stomach. Elderly individuals who regularly consume porridge tend to be thinner. It is because their gastric motility is poor. If they consume excessive amounts of porridge, they struggle to empty it quickly, leading to stomach discomfort. The same volume of porridge contains far fewer grains than rice. Therefore, porridge, when consumed regularly, will not provide the total calories and nutrients needed by the body. Furthermore, due to the use it or lose it principle, consuming overly watery, soft foods for a long time eliminates the need for the stomach to digest them, leading to further impairment of digestive function. Overcooking vegetables. Many older adults prefer to blanch vegetables first and then boil them in water for a long time, making soups like spinach and cabbage. This method actually cooks away many of the vegetable's water-soluble vitamins, leaving them with little nutritional value. Therefore, elderly individuals should avoid overcooking vegetables. Instead, we chop vegetables first, stir-fry quickly, eat them cold, and choose a variety of dark-colored dishes. If you're concerned about osteoporosis, the more calcium you take, the better. Many older adults believe that the more calcium they supplement, the more they absorb and the more bone they build. It is not true. Generally, people over 60 need 800 milligrams of calcium daily. Excessive calcium supplementation doesn't convert calcium into bone, but can actually cause health complications and increase the risk of kidney stones. Excessive calcium can also interfere with the utilization of iron and zinc. Fear of waste leads to frequent consumption of leftovers. Older adults often consume leftovers to avoid waste, but it's essential to grasp that the nutrients in food degrade over time, particularly as people age. While proteins and carbs degrade less than micronutrients like minerals and vitamins, it's crucial to prevent protein, fat, and carbs from spoiling or growing mold when storing food for a long time. The longer something is stored, the more likely it is that the leftovers will produce nitrosamines. If not heated thoroughly before consumption, they can easily breed bacteria and other microorganisms, leading to gastrointestinal problems. Older adults have more fragile gastrointestinal functions, so they should eat food according to their family's daily needs, avoid overcooking, and minimize eating leftovers. The lighter the food, the better. Many people are getting diseases of prosperity because their living standards are going up, which is making people want to eat lighter. This way of doing things isn't bad, but it shouldn't be taken too far. Vegetarians shouldn't give up meat either. Essential fatty acids are found in a certain amount of fat that the body needs. A balanced diet with both meat and vegetables is optimal for maintaining a balanced budget. Eating too many whole grains. Some older adults increase their intake of whole grains, believing they are beneficial, or people with diabetes completely replace their staple food with whole grains to control their blood sugar. Whole grains are rich in insoluble dietary fiber. Excessive consumption of whole grains over a long period can lead to indigestion, bloating, and interfere with the absorption of other nutrients, leading to nutritional risks. It's important to remember that while ensuring a variety of foods at each meal, you have the power to make informed choices about your diet. Developing a habit of eating 3 meals at regular times and in regular amounts is key. A scientific diet and balanced nutrition protect the health of older people. As living standards improve, more and more foods are available. At the same time, nutritional science is constantly evolving. The doctor offers the following nutritional supplement recommendations on how to achieve optimal nutrient intake and protect the health of older people through a scientific approach. Good protein. It stops muscle loss more quickly. People over 65 need a lot of protein, but they often have difficulty digesting and absorbing food. Soy products, eggs, fish, and other high-protein foods that are easy to digest should be what they choose. Calcium. It helps bones stay strong. Bone mass slowly decreases with age, so people need to make sure they get enough calcium to keep their bones healthy. Calcium-rich foods such as milk, tofu, kelp, and leafy greens can be helpful. Vitamin D aids calcium absorption and utilization. Older adults should get plenty of sunlight and consume foods rich in vitamin D, such as cod liver oil, eggs, and milk. Dietary fiber promotes digestion. Older adults experience decreased gastrointestinal function, making them more prone to constipation. Therefore, they need adequate dietary fiber to promote intestinal motility. Folic acid, B12, and B1 supplementation reduces homocysteine levels. Inadequate intake of folic acid, B12, and B1 can increase homocysteine levels, increasing the risk of atherosclerosis and coronary heart disease. Food examples include green leafy vegetables, animal liver, red meat, whole grains, and fermented soy products. Essential fatty acids, such as DHA and EPA, reduce blood lipids and the risk of blood clots. Fatty acids promote brain health, help lower cholesterol and triglyceride levels, and promote the metabolism of saturated fatty acids in the body. It reduces blood viscosity, improves blood circulation, and prevents fat deposition in blood vessel walls. It helps prevent the formation and progression of atherosclerosis and cardiovascular diseases such as cerebral thrombosis, cerebral hemorrhage, and hypertension. Food examples: salmon, seaweed, flaxseed, and nuts. Antioxidant nutrients, such as vitamin C, vitamin D, selenium, and anthocyanins, reduce oxidative stress and chronic inflammation. Antioxidant nutrients help eliminate free radicals in the elderly, reduce inflammation and endothelial damage, and reduce the risk of cardiovascular and cerebrovascular diseases, tumors, and other diseases. Examples of food include blueberries, citrus fruits, green peppers, carrots, sea buckthorn, and red cabbage. Chromium, blood sugar lowering. Chromium participates in insulin synthesis and sugar metabolism, aiding in blood sugar lowering. Examples of foods include beef, liver, brown rice, pepper, and yeast. Summer nutrition tips for seniors. Summer is almost here, and the weather is getting hotter. Seniors should take daily precautions against heat stroke and pay attention to their diet. Summer heat is particularly intense, but perspiration destroys bodily fluids and drains qi. For this reason, it is recommended to consume a heat-clearing and summer heat relief diet, which involves stimulating the spleen and stomach to eliminate dampness, restoring qi, and encouraging bodily fluids to cool down during the summer. A healthy diet should promote heat clearing and summer heat relief, replenishing qi and promoting body fluids, and eating more vegetables and legumes with a cooling, bitter, and pungent nature. Indulge in tofu, watermelon, bitter melon, mung beans, corn, lentils, lotus seeds, and lotus leaves. Moderate amounts of low-fat meat, fish, shrimp, chicken, and shellfish, peaches, black plums, strawberries, tomatoes, and cucumbers. Eat less meat, especially red meat, as it can easily generate phlegm and heat. Also, eat less sugar, as older people tend to have high sugar and calorie intake. If older adults consume too much, it can generate heat and impair digestion and absorption, leading to indigestion and symptoms such as loss of appetite, abdominal distension, and a greasy taste. Recommended diet: mung bean soup. Instructions: 150 grams mung beans, a small amount of rock sugar. Wash the mung beans and soak them in clean water for 10 minutes. Pour the mung beans into a pot and add an appropriate amount of water. Bring to a boil over high heat, then reduce to low heat and cook until the mung beans have bloomed. Remove from heat and add an appropriate amount of sugar to taste. Benefits: it clears heat and detoxifies, relieves heat and restlessness, quenches thirst and strengthens the stomach, promotes diuresis, and reduces swelling. Sour plum soup. Instructions: 100 grams black plums, 100 grams hawthorn, 10 grams licorice root, 5 grams candied osmanthus, and an appropriate amount of rock sugar. First, soak the black plums, hawthorn, and licorice in clean water for 30 minutes. Add 1,000 milliliters of water to a clay pot. Add the soaked black plums, hawthorn, and licorice. Bring to a boil over high heat, then reduce to low heat and simmer for 30 minutes. Add an appropriate amount of rock sugar and simmer for another 10 minutes. Finally, add a small spoonful of candied osmanthus and stir well. Benefits: it helps digestion, regulates the stomach, promotes qi and dissipates blood stasis, promotes fluid production and quenches thirst, strengthens the lungs, relieves restlessness, and calms the mind. Daily light exercise recommendations. The goal of exercise for older adults is to slow the decline in athletic ability associated with aging, increase muscle mass and strength, delay the decline in strength and endurance, improve cardiopulmonary function, enhance cognitive function, control chronic diseases, reduce the risk of physical disability, and prolong life. To improve their physical function, it is recommended that older adults engage in moderate resistance training combined with aerobic, stretching, and balance exercises. Aerobic exercise should be performed 3 to 5 days per week at a moderate intensity for 30 to 60 minutes per day or 150 to 300 minutes per week. Examples include walking, underwater walking, fixed load cycling, and calisthenics. Resistance exercise should be performed approximately twice per week for 10 to 30 minutes, such as using small dumbbells, weighted walking, bench presses, and squats. Select exercises based on individual needs and avoid overdoing them. Thank you for watching our video. We will see you again in the next topic.